Now, the death toll from the coronavirus pandemic in Asia is over 21,000, with countries like China, where the virus originated, and Iran being the worst affected. And yet Asia has a much lower death toll than Europe and America. China, which has officially recorded 4,633 cases, has registered just about one death in the past 3 weeks linked to COVID-19. And when it comes to South Asia, the pandemic appears to be far more controlled. Now, the hardest hit South Asian country is India, with over 56,000 cases and fatalities that are just a little under 1,890 as on the 8th of May. Although India's coronavirus trajectory has tapered off in the last month, it of course continues to remain steeper in comparison with other Asian peers such as Japan and Singapore. Now, the rise in terms of infections in India is now faster than in neighbouring Bangladesh and Pakistan, and at the current rate, India's coronavirus cases are likely to reach 75,000 mark in another just 5 days. Now, according to estimates, India remains under a nationwide lockdown with some relaxations in certain areas that have reported nil or very few cases. Let's now shift our attention to neighbouring Pakistan, where Pakistan's Prime Minister Imran Khan has announced plans to begin lifting Pakistan's poorly enforced lockdown from today, amidst fears for the country's economy as it is sinking into recession. The officials have reported about 1,764 new COVID-19 cases in the last 24 hours, taking the total number of cases across Pakistan to 25,837. The death toll has also risen to 594. After having reported just a handful of COVID-19 cases in late February, Pakistan's numbers began to surge from mid-March. Meanwhile, in Bangladesh, this week the lockdown was extended until the 16th of May to try and contain the deadly coronavirus. However, Bangladesh allowed Muslims to attend the Friday congressional prayers in mosques, as the government has begun easing some of the lockdown restrictions. Currently, the nation has about 12,425 cases, with just about 199 fatalities. Now, in Afghanistan, according to a report by the Global Migration Agency, Afghanistan could have one of the highest COVID-19 infection rates in the world. As of the 8th of May, the country has reported over 3,500 cases and over 100 deaths. However, Afghan officials have emphasized that in the absence of urgent action, up to 80% of the country's total population of 35 million could be affected. Meanwhile, in Sri Lanka, of the 824 active coronavirus cases in the country, 327 of them are from the naval personnel from a specific camp. The virus has so far claimed 9 lives in the island nation. With less than 1% mortality rate, the authorities intend to ease restrictions to try and revive economic activities while enforcing some strict health guidelines. Meanwhile, in Maldives, which is a major tourist hub in South Asia, Maldives confirmed its first 2 cases of COVID-19 on the 7th of March, and since then the nation has reported under 700 cases with only 3 deaths. The government in Maldives has extended the lockdown in Greater Malay region until the 14th of May. And the country has also put into place some strict travel restrictions, considering it is one of the most exotic travel destinations and attracts tourists from around the globe. The Maldives says that it could reopen borders by July and also restart tourism tentatively sometime from October onwards. Meanwhile, in the Himalayan nation of Nepal, the nationwide lockdown is extended until the 18th of May. It has suspended international flights and cross-border movement with neighbouring countries such as India and China until the 31st of May to stem the spread of the deadly coronavirus. The first case of the COVID-19 pandemic was confirmed in Nepal on the 24th of January in 2020 in Kathmandu. So far, the nation has done well in containing the pandemic with just 101 cases and no deaths having been linked to COVID-19. And also, Bhutan has reported just 7 cases of COVID-19 infections and no fatalities linked to the coronavirus infections. Bhutan has done extremely well in controlling the pandemic at a time when the world's most developed nations are grappling to control the disease. This despite the fact that the country never went into complete lockdown. However, all educational institutions remain closed.